Good morning. My name is Corinna Dan, and I'm here at the U.S. Conference on AIDS 2018, USCA 2018, where a big theme of the conference is health equity. During this conference, I presented on hepatitis elimination as a health equity issue, and I thought it would be terrific to share it with our Facebook audience, and really excited to be here today and to share my presentation on hepatitis as a health equity issue. So, want to get into the slides that I presented, and I think I am going to learn how to use Facebook Live. Here at the conference, there is an incredible diversity of people. It is just an amazing opportunity to talk about issues of health equity and HIV as well as hepatitis. And in our office, at the Office of the Assistant Secretary for Health at the Department of Health and Human Services, we really do focus on health equity in a number of ways. One of those ways is as we're implementing our national strategies, and today I wanted to talk a little bit about the National Viral Hepatitis Action Plan. We, at our office, monitor this plan to try and reduce health equities. And when we developed the action plan, we really developed it as a tool to look at where the health disparities exist and how we as a nation together, working with the federal government, working with the community, non-federal partners, community-based organizations, public health, to really all pull in the same direction, taking our fight against viral hepatitis into a new phase with this national plan. And we really looked to make this a plan that everyone could join in on so that we can all pull in the same direction, work on those same health disparities, and use it as a tool to guide individuals and organizations from all sectors of society to strengthen our collective response to hepatitis B and hepatitis C infection. We have a vision in this country, and as we developed the action plan, we were encouraged by people across the country to really think boldly about viral hepatitis. And so this vision is a vision in which the United States will be a place where all new hepatitis infections have been eliminated, where all people with hepatitis B and C will know their status, and everyone who has chronic hepatitis B and C infection has access to high-quality health care and curative treatments free from stigma and discrimination. So in order to attain that vision, we identified 4 goals. They're pretty simple goals. They work for both hepatitis B and hepatitis C. And you can see that the third goal is the reducing viral hepatitis health disparities. So that is one of 4 major activities that we do as part of implementing the National Viral Hepatitis Action Plan. Because in viral hepatitis, many disparities exist. We've seen increases in hepatitis C infections, a tremendous increase, in fact, about 350% increase between 2010 and 2016, and those increases were pretty steep between 2015 and 2016, and where we had seen real decreases in new hepatitis B infections for many, many years. For the first time in a long, long time, we saw increases in hepatitis B infections in some states. We see racial and ethnic disparities related to hepatitis B and C. We see American Indians have the highest rate of new hepatitis C infections, as well as hepatitis C related deaths. And African Americans suffer from health disparities as well, with high rates of hepatitis B infection, as well as hepatitis B and C deaths. Asian Americans also have health disparities related to hepatitis B, representing only about 5% of the whole U.S. population, but more than 50% of all people in the United States who have chronic hepatitis B. So the other group of kind of health disparities that we see with viral hepatitis are really related to life circumstance and comorbid conditions that people have. And if you think about the general U.S. population, only about 1% have chronic hepatitis C, but 2.8% of baby boomers, people born between 1945 and 1965, are estimated to have hepatitis C. As well, veterans, people who inject drugs, people in prison, people who are incarcerated, and people living with HIV have health disparities. And most recently, we've seen outbreaks of hepatitis A among homeless individuals, as well as people who use drugs, bringing back up an important opportunity to vaccinate to prevent hepatitis A, where before we had decreasing hepatitis A infections, and we really thought we had overcome that public health threat. But it's rearing its ugly head again, and it's all around health disparities here. The action plan identifies indicators. So these are the numbers that we use to track progress toward our national goals. And there's a whole lot of health disparities in hepatitis, so we have a whole lot of indicators related to that goal of reducing health disparities. And you can see there just the detail that we looked at when we developed the action plan, and the real measurable indicators that we're using to see how we're doing as a nation in fighting viral hepatitis. The 11 priority populations all in one place here on this slide. I know that among our audience, many people work with multiple priority population groups, and these are people who are at risk of getting new viral hepatitis infections. They may be more likely to die of hepatitis-related causes, or they may just be at risk for transmitting viral hepatitis. So if you work with any of these groups, I would encourage you to learn more about hepatitis B and hepatitis C, and what you can do in your work, in your community, to address these the health disparities of hepatitis B and C among these groups. So some of the things that we encourage people to do are to look at what they're doing in their community, in their organization, to develop a plan, because it's critical to have a plan where you understand where you are now and where you want to get to as you work to address health disparities. Very important to have a goal and to engage a broader community effort in your work. So when you make that plan, work with other organizations, work with other individuals, and really importantly, include people who represent the populations that you serve. If you can, bring them in to the planning process so that you can make sure that you're meeting their needs. We need to understand better what those data look like, and we also need to find innovative ways to support the viral hepatitis testing and care and treatment that is really critically needed in order to eliminate those health disparities. So I would encourage everyone to think way more broadly than you ever have before, because hepatitis C is increasing. Hepatitis B is increasing in some areas of the country, especially those hardest hit by the opioid epidemic. And we have the tools. We have effective treatments that cure people of hepatitis C. We have vaccines that can prevent hepatitis A and hepatitis B, but we're not using those as effectively as we need to get to viral hepatitis elimination in the United States right now. One of the ways that our office is working to support community organizations and public health groups is by developing this partner planning guide and making it available on our website. This partner planning guide is really designed for organizations that want to ramp up their game. To get more engaged in viral hepatitis. And it's a very simple guide. It can help planning groups, it can help coalitions, and it is available on our website. So I hope you'll visit hhs.gov/hepatitis and go to the action plan page and see what we have there. Check out the indicators, think about the populations you're working with, and how this partner planning guide can help you. Because we've got those scientific advances already. We've got improvements in the healthcare, and it is possible to win the fight against viral hepatitis in this country. So I hope that you'll join the fight. I hope that you'll think about how we can be more collaborative, how we can better support you. And I hope that you'll tune in to hhs.gov/hepatitis, where we can make these slides available. You can follow us at HHS_viral hepatitis. And we are looking for opportunities across the board. So join us, contact us, reach out to us, follow us on Facebook, check out our blog. And think about how you can work to address viral hepatitis health disparities in your community. Thanks for joining us here on Facebook Live today. Really excited to do this at USCA 2018, and I hope to talk with all of you again soon and see you as we work to fight against viral hepatitis together.